Hi everyone, welcome to my channel Newsome. I hope my videos are informative to you all in some way or the other. Please leave any feedback. I would highly appreciate that. So yesterday on Monday, under new federal rules, Trump's top healthcare aide said they have finalized federal rules for sharing your personal health records with doctor, hospitals, and insurers. So in order for them to make it easily available electronically. Seema Verma, who is the administrator of the Centers for Medicare and Medicaid Services, said this will allow them to have their complete medical record at their fingertips. So your personal health data will obtain all of your personal information, such as the history of your illnesses, lab results, prescriptions, and even maybe genetics. The record of this personal information will be seen as gradually valuable to companies that can strike wide databases to develop healthcare services. Big companies including Apple, Microsoft, Google, and Alphabet are making progress in the healthcare market and using artificial intelligence and other software tools. The final rule issued within the Department of Health and Human Services expects to make developing software products faster, easier, and less expensive. Basically, it will be an easier access to personal digital health records as compared to the traditional way where, you most likely you need to carry your printout or physical disc to a new doctor's office or even put input data by hand. Like I said earlier, the main goal under the new rule is to set technical standards that will authorize app developers or others with authorization to connect digitally with doctors and hospital offices to get information such as lab test results, medicines, medications, and vital signs such as blood pressure. Now, if you see from a positive outcome, patients will be able to get their health information all in one place onto their smartphone devices from all the different doctors and hospitals they have been to. Harvard professor Ken Mandel says it will be absolutely transformative. He directs a health informatics program at Boston Children's Hospital. He also adds that no one can get data out of electronic health records into applications in a standardized, effective way, so we don't get innovation at scale. But this new Privacy Act can cause a big debate and negative outcome over patient privacy protection. Why? Because now hospitals are reaching deals with companies such as Microsoft and Google to share their data. Chief Executive Chip Khan of the Federation of American Hospitals said in a statement that hospitals are held to high standards to protect our patient privacy and security, and apps should be doing the same thing too. According to the American Hospital Association, the privacy policies are not enough around apps. Now, as patients begin easily to give their health information to apps, it won't be the same for federal law to protect that health data, which is HIPAA, which stands for Health Insurance Portability and Accountability Act, would protect this new rule. Because if tech companies get health data directly from patients or from doctors or hospitals that release it based on consumers' authorization, usually it won't be protected under HIPAA. HIPAA only comes in play to doctors and healthcare companies, as well as third parties that work with them, such as the technology companies with which hospitals share data. And if patients share their secure and sensitive health data with organizations, then the main concern is that they can use and sell that information however they want. Now, according to the Trump administration officials, said the rules only are accessible for doctors, hospitals, and insurers to check apps' privacy policies and share that information about them with consumers. And also, patients will be able to select which specific information they want to share. Healthcare providers can warn consumers when their data might be leaving the protections under HIPAA.